nga yeebaza ekitongole kya GAVI UNICEF olw'obuwagizi bwe bawadde pulogulaamu eno, era nga yeebaza ne gavumenti ya Uganda ne disitulikiti y'e Mukono olw'okuwagira enteekateeka eno ey'abasawo b'oku byalo. Ategeezezza nti ng'abasawo b'oku byalo bakola omulimu gw'amaanyi okuyamba ku bantu baffe mu byalo eyo, era nti essanyu lyabwe lisibuka nnyo mu kulaba oluvannyuma lw'okumubatuusaako obuweereza, nti era bwe balaba maama asumulukisa obulungi olw'obuyambi bwabwe, oba taata asanyuka ng'omulwadde we atuusiddwako obuweereza, beekyo kibongera essanyu. Era ategeezezza nti bo kye basinga okukola kwe kutuuka ku balwadde eyo mu byalo ne bakola okubongerayo ku mitendera egiddako bwe balaba nga kyetaagisa. Yeebazizza ekitongole ekya Nama Wellness n'ategeeza nti kibakozemu omulimu gwa ttendo okubasomesa ate n'okubawa obuwagizi. Ategeezezza nti obuyambi obubaweebwa bubongeramu amaanyi ate n'okuboogiya okubasobozesa okutuusa empeereza yaabwe ku bantu be bakolamu emirimu. Ayongedde okwebaza ekitongole kya GAVI UNICEF, gavumenti ya Uganda ne Mukono District, era n'asaba nti singa kisoboka enkola eno ey'abasawo b'oku byalo yalibadde eyongerwa obukugu, abantu abo ne babongeramu obukugu ate ne bababunya buli katundu ka Uganda yonna. Era awunzise nga yeebaza ne banne byabba ekiti abakola omulimu guno ogw'okutuusa obuweereza ku bantu baffe mu byalo.
Thank you very much for that summary in Uganda. And we will carry on with our speeches. I will take this opportunity to invite the chairman, LC5, to make his remarks, and he will later invite the resident district commissioner. And let's keep time, please, because time is not on our side. LC5 chairman, you're welcome.
The Honorable Minister for Health, the Permanent Secretary Ministry of Health, the Director General, all officials from the Ministry of Health, our resident district commissioner, our development partners globally, like GAVI, and also other development partners nationally, members of the District Executive Committee, the Honorable Speaker of Omukolo local government, all Honorable District Councillors, the Chief Administrative Officer, the District Health Officer, and the entire technical team, all LC3 chairpersons present, headed by the LC3 chairperson in Nama sub-county, and your vice and the honorable councillors present, invited guests, ladies and gentlemen. I am Haji Asmani Muzarubowa, the district vice chairperson in Mukolo district local government, and on behalf of the district chairperson, Naomwami, Honorable Dr. Reverend Peter Bakaluba Mukasa, who has not been able to be with us today because of official duties. He's abroad, but in spirit, he's with us. Ladies and gentlemen, allow me to convey warm greetings from him to you, PS, and our development partners, and also to thank you for the passion that you have showed to make sure that the people of our district, their lives are put to good use. On behalf of Omukolo District Local Government, I would like to take this opportunity to thank the government of Uganda, the Minister for Health, the PS, and above all, to thank His Excellency the President of the Republic of Uganda for the tireless efforts in place that have been put in place to make sure that all Ugandans in this country get adequate health services. Thank you very much, and we wish you a good stay. Allow me also to take this opportunity to thank GAVI and UNICEF for the good work you have done for this country. We thank you very much. We thank you for the funding, and we pray more apart from what you have done. Madam PS, it is common knowledge, and it is known to every person in Katogo here and in Amasabu County, that in 2014, His Excellency the President of Uganda, accompanied by the then Honorable MP, Honorable Chibule Ronald, launched and elevated the Katogo Health Center 3 to a Health Center 4 status. Since then, through the government of Uganda, we have put in place an OPD, as you have seen, a staff house, a 3-in-1 patient ward. Currently, we are in the final stages of finishing the theater. Madam PS and involvement partners, our prayer as a district right now, actually to the Honorable Minister, is to support us with equipment of this facility. Number two, also to make sure that wage is catered for to have the people who are supposed to be in this facility. Our guest of honor, allow me to thank Madam PS. Personally, I've been following you, and we have been traversing all over this country, trying to monitor and make sure that the people in this country get good services. Thank you very much, and I wish that you follow that road. Honorable Minister and Honorable PS, allow me also, before I leave this podium, to thank our Chief Administrative Officer, and also to thank the District Health Officer and the entire technical team for the good work they have been doing in making sure that the lives of our people in this district are catered for. As you have heard from the previous speakers, for us as Omukolo, we are behind the Ministry of Health, and we are also behind and support His Excellency the President of the Republic of Uganda. With those few remarks, allow me to briefly introduce the members that have accompanied me here. This Honorable Minister and PS, this is Honorable Martha Nasazi. She is the Secretary for Health and Community-Based Services, Omukolo District Local Government. This gentleman here is called Honorable Mwesigwa Sentongo Robert. He is the Minister for Works and Transport in our district. This is Honorable Wampinathani Afende. He is the Honorable Minister for Production, Marketing, and Commercial Services. We have our former Minister. The chairperson has just made a reshuffle. This is the former Minister for Finance. This one is also the former Minister for Health. So they have been members of the Executive Committee, and we thank them for the good work they have been doing. We have Honorable Mpirito. He's the chairperson of the Health Committee, Omukolo District Local Government. We have Honorable Senyonjo Rewen. He's the Youth Councillor representing all youths in Omukolo District. Let me hope there's no one I've left behind. Madam PS, we had the district speaker with us in the morning, but I think due to unavoidable circumstances and also a number of councillors, they have been here to commemorate with us. So we thank you for choosing Omukolo, because as someone said, you could have decided to go to Moroto or Kanungu, but thank you for choosing Omukolo, and we are always behind you for God and my country.
Thank you very much. The next speaker should stand on the protocol because we have another program after here, and you should be able to utilize 5 minutes, and I request the resident district commissioner to come, who later invite the area MP and later invite the PS. And strictly, the Director General has taken over the program. 3 minutes. Thank you.
Thank you so much. Our guest of honor, the CEO GAVI, with the people that you moved with, our PS, Dr. Diana, a friend to Omukolo, all protocols, our area MP and the former MP, our community, Nama community, Jemuli vibe nga sijuulira. Muwanike mikono CEO wa GAVI atulabe, ne Dr. atulabe, bye tusaba bisobola okuyitamu. Munzikirize, I want to speak in English because our CEO GAVI doesn't understand Luganda, but I'll speak in Luganda for purposes of mobilization. We thank you so much, Madam CEO GAVI, for entrusting Uganda as a country with your funds. Thank you so much, and we thank the government of Uganda. Through you, Madam PS, I hope you are going to reach our thanks to His Excellency the President for allowing the development partners in our country. And this is why we are seeing a percentage increase in the children that are immunized in the country Uganda. Research shows that around 2011, around 90 children out of 1,000 were dying because of lack of immunization. But as we speak now, we are having 52 only out of 1,000 that are dying. And the cause of that is lack of creating awareness and sensitization. This is where I stand now to ask my fellow leaders, the political leaders, the VHTs, the local leaders, to ask you go and create awareness around the villages. Speak about immunization, the good that we get after immunizing our children. Tell them that children that are not immunized suffer a lot when they go in schools because they don't participate in all games that are prepared in schools because they cannot participate with their disabilities. Fellow parents, mothers and fathers, it is a call to you all. Appreciate whatever program, whatever plan the government has brought on board through the VHTs who are doing a commendable job. We thank the UNICEF for facilitating them with phones, smartphones, because they are now doing work using the ITC, which is a very good duty. And through you, Madam PS, we thank you so much for putting Omukolo at a forefront. Everything has been alluded. There is nothing much that I'm going to speak. But as a representative of the President, we shall be very happy. Togo raised to the status of Health Center 4. That is a policy because we have 18 sub-counties. Only 2 in the Health Center 3. Now, if you upgrade Katogo and Goma Health Center 3 to a status of 4, work and service delivery will be done. We thank you so much because I know you are going to do all of this. With the powers entrusted to me as the representative of the President, allow me to invite the area member of Parliament to give his speech and submission.
A big clap for RDC, please. You don't need to observe.
Thank you. The Director General has told me protocol observed. Madam CEO, GAVI, Madam Permanent Secretary, our good residents, ladies and gentlemen, good afternoon. First of all, I appreciate Madam PS, among others, for having selected Mukono District and Katogo in Mukono North in particular for hosting you this afternoon. Thank you very much. We appreciate all the services so far offered to our people in the health sector. We thank you for all the partnerships entered into purposes of streamlining the health sector for the good of our people, from GAVI, Gates and Melinda, UNICEF. We appreciate all those facilities. I'm going to take a few minutes only to highlight the challenges and put you in the know, at least the few issues which are affecting us, where you can help us. And it is true, as one of the speakers here said, personally I availed an ambulance, but it is cutting across various sub-counties. Of course, I'm aware the government has come up with a policy to distribute various ambulances. As we call upon you to expedite the process of elevating this health center to Health Center 4, we also call upon you in the next phase to avail us with an ambulance to help, which can be stationed at this health center, which is serving more than 6 sub-counties at the neighborhood, including this sub-county, but 6 others are getting facilities from here. So we need a stationed ambulance at this health facility. As we are completing all the facilities, the building, the health, the staff quarters are completed, the theater is completed. Kindly avail us with all the machines available which can enable our our doctors here to do some surgeries, and before they can make some referrals to the nearby hospitals. Finally, somebody is disturbing the PS. I need her to hear me well. Madam PS, in the neighborhood here, in this very sub-county, we have a parish which has over 15,000 people, residents. They are made to traverse various parishes to reach here. We need health center too in that parish called Namaojolo. At the same time, we have already acquired land in Namobiro. Kindly help us to establish a health center too in that area to enable us serve our people very well. With those few remarks, I take this opportunity to invite you to talk to this congregation. Thank you very much. With me is the Speaker of this sub-county, together with the Honorable Councillor who was earlier on introduced. Thank you very much.
Our chief guest, this afternoon, Dr. Sanya, the CEO of GAVI, the country representative of UNICEF, the acting country representative of WHO, the country representative of PATH. I've seen quite a number of partners, although I didn't get opportunity to I hope I'm not missing a number of you, but I really want, and Chai, our senior officials led by the Director General, district leadership that has welcomed us here very, very well, and the people of Nama Mukono. I will request really that you forgive us when we are rushing. Would have come earlier, but we had so many other competing engagements. And even from here, our CEO has already engagement that is waiting for her in Kampala. So we really want to shorten this. So I will just make only three things. The first one is that we want to appreciate the health workers. The numbers that we see, our VHTs and our leaders that are involved in mobilizing the people to get vaccinated, we don't take this for granted. Because in many other places we have seen where the people are not working with our teams, it is not working. Or when we see those anti-vax sentiments, they keep away the people from accessing the services. So we want to thank the people of Mukono, the leadership, our health workers, and most importantly, the VHTs, for the work that you are doing. We want really to appreciate you. The second, our chief guest, I remember when we were coming, you asked me what would be the most important thing. The most important thing that would transform our sector is digitalization. And you have seen the role it is playing in getting the zero-dose children, linking them to care. Just getting to the household, they get registered and make sure that these people are linked to care. We do believe that if we roll out this e-community extension, e-community health information system all over the country, it will definitely make things much, much better. Mukono is performing very well because partly the VHTs are able to follow through to make sure that they link all these mothers to antenatal, they are able to follow their children on zero dose because we have all that data captured and we are able to follow through. We are only implementing the community health information system only in 17 districts. We have 140 districts. And so it's like a drop in an ocean. And we do believe that if we implement this, it will take us a long way and will improve not only the statistics at household, but we'll be able to budget effectively and we'll be able to budget with precision based on the accurate data. And even at household level, the interventions that we plan will be effective because it will be based on evidence. Whatever we shall be doing at household level will be really based on evidence because of the data that we have. And this is what we want to see in all districts rolled out. Thirdly, as I just want to conclude my remarks, I want to thank the GAVI. I want to thank the partners that have been working with us in the country. UNICEF, WHO, CHAI, PATH, for working with us to make sure that really the vaccination programs are meaningfully transforming the lives of the people. We want to thank you for availing the fridges. These fridges, as I told you, they are giving us, we are seeing miracles happen in our communities. Because our health workers used to go many, many kilometers to go to outreaches, and they would pick vaccines from the centers where we had power, or a few that had solar powered fridges. But now kati munzikirize mpite omugenyi waffe omukulu azze wano okutulaba n'okulaba emirimu gye tukola n'okutujjukiza nti tulina okujjumbira okugemesa abaana baffe. Tulina okulaba nti abaana baffe bonna tebafa mu ndwadde zinamutta ezibadde zitta abaana baffe. Twagala okubajjukiza abazadde abakyawuliriza abatubuzaabuza, manya bw'ogemesa abaana bajja kufa, ojja kutta amagi g'abaana, abaana bajja kuba tebazaala. Ebyo si bituufu. Tewali ggwanga likola program ey'okutta abantu baalyo. Tekisoboka. Programu zaffe ezigema, omukyalo n'avudde Geneva n'ajja ne ttiimu ye wano okutulaga nti batuwagira ate bamanyi bye tukola ate n'okutuzaamu amaanyi n'okutubuulira nti bajja kugenda mu maaso nga batuwe support, batuwe eddagala erigema ate twongere okugemesa abaana baffe baleme okufa. Mu myaka gino tetwagala kuwulira omwana afa lukusense, tetwagala kuwulira nti omuntu afudde polio, Tetwagala kuwulira muntu nti afudde endwadde ezigemebwa nga TB. Mukitegedde bannange? Mutwale message eyo mugende tubunyise enjiri eno tulabe nti abaana bafe abawala ku myaka 10 bagemebwa obukuwa obuuko obuleeta kansa aleta kansa y'omumwa gwa nnabaana. Abaana bafe abawala tulina okugenda tugemese HPV abaana baffe. Tetwagala kuwulira nti omwana waffe akuze ate afune kansa ey'omumwa gwa nnabaana ate ng'eddagala lyaliwo okugema okuziiza obulwadde obwo. Mwebale nnyo mwebalire. Allow me, madam. So allow me, madam, to invite you to come talk to us. We shall summarize your comment because we want these people to know the message that you have brought. As you are coming, we want also to take the opportunity to welcome one of our guests from the British High Commission, who has come also to join us. Thank you very much.
Good afternoon, Excellencies, ladies and gentlemen, Honorable Permanent Secretary, the District Health Officer, distinguished guests, and most importantly, mothers, families, our village health workers. It's really wonderful to be here with you today.
Abagamba nti asanyusa okuba wano olwaleero okubalaba.
I am so very touched and humbled by your warmth, by your hospitality, by your commitment to be here in this pouring rain to welcome us. I cannot tell you how touched I am.
Nti agamba nti musanyufu nnyo ate ayongedde okuwulira nga abasanyukiddeko kubanga engeri gye tumwaniriza, engeri gye mulinze wano ne mumulinda wano n'okumwaniza kwe tumwanirizaamu ayagala kubeebaza.
You are the heart and soul of Uganda, and I'm so privileged to have the opportunity to meet all of you.
Mwe mutima gw'eggwanga ate asanyuse nnyo okubalaba olwaleero.
This rain is truly a blessing, and it is a blessing for the people of Uganda, for the people of Mukono district, people of Katogo. It's a blessing for you as you celebrate your 50th anniversary of immunization.
Nti enkuba eno ate yongeddemu n'okutuwa omukisa. Omukisa guno oguzze mu bantu b'e Mukono, ab'e Katogo, abannaama, ddala ddala kituufu enkuba eno etulaze nti ya mukisa.
I'm here to congratulate you. I'm here to congratulate you for what your country has achieved in immunization.
Ayagala kubayozaayoza okusingira ddala bye tusobodde okukola ng'eggwanga mu area eno ey'okugemesa. Ayagala akubasiima ate agala n'okusiima n'eggwanga lyaffe kye tusobodde okukola.
Your country has one of the highest coverage rates of immunization. I'm not sure if you know, but your country and your people vaccinate people with the highest number of vaccines, and next year you will be rolling out the largest malaria vaccine program in the world.
Ayagala n'okubeebaza kubanga mmwe abantu aba bulijjo mujjumbidde okugemesa nti eggwanga lya Uganda erikyasinzeemu okuba n'ennamba endwadde ze tugema obungi. Ate omwaka ogujja tugenda kuleeta n'eddagala erigema malaria nga lye lisingirayo ddala obunene mu nsi yonna, genda kutandikira wano.
I have seen innovations here in Uganda which I have not seen anywhere else in the world. You celebrate the Integrated Child Day. Your Ministry of Health has introduced digital learning for community health workers, and you have a clinical cadre of professionals who will help save lives in centers like this very soon.
Alabye ebitusobosezza okukola omulimu guno bulungi ng'eggwanga. Ekyokusooka programu yaffe ey'okugema tugikwatiramu, tukola bwe tuba tuzze okugema abaana, ate tukola n'ebirala ne tubawa n'eddagala erya multivitamini ne tukola kye tuyita Integrated Child Health Days. Ate n'ekirala alabye nti enkola yaffe wano mu ggwanga kati nga gana amalwaliro aga wansi ne tuteekamu n'abasawo abansa okutuuka kumpi n'abantu. Ekyo si kya bulijjo, naye akitusiimira ate agamba nti kino musanyufu okukiyiga. Ate n'okusingira ddala olwaleero alabya omwami abadde aga digito aba community health aba VHT engeri bwe bagenda mu nnyumba ne bawandiika abantu nga bakozesa essimu nga bakozesa digital solution okulaba nti information eno yonna tugikozesa ate ne tuyamba ne tutuuka ku baana abatannaba kugemebwa.
Your government should be congratulated for these investments. I met His Excellency the President this morning, and it was amazing to see his commitment to invest in the health of people of Uganda.
Yasanyuse nnyo olwaleero bwe yabadde alina olukiiko ne mukulu w'eggwanga President Yoweri Museveni, ate n'alagira ddala okukakasa kwafunye okuva ow'omukulu w'eggwanga ne commitment gy'alina okulaba nti ayagala kulaba nti ebyobuweereza ebyobulamu byongera okutumbulwa ate biganyulwa abantu ba bulijjo.
But more than anything else, and I want to emphasize, more than anything else, I want to acknowledge and recognize the faith of mothers and communities. I want to recognize the faith of mothers and communities throughout Uganda who bring their children for immunization and who understand the value and safety of vaccines in protecting the future of their children and protecting their generations.
Ekisingidde ddala okumuzzaamu amaanyi kulaba nti abakyala baffe bannakazadde batukkirizaamu ne baleeta abaana baabwe ne tubagema ate ne batukkirizaamu ne message gye tubawa okulaba nti abaana baabwe bonna bagemebwa ate ne batuwuliriza ne betubayigiriza ne batuwuliriza ate ne babikola.
Every vaccination is a step towards a brighter and a healthier future. We have come a long way in celebrating 50 years of immunization and saving millions of lives in Uganda. And by your presence today, I can see that we can save many more lives. We can save many more children from death and disease.
Olwaleero kindaze nga tumitinga omukulu w'eggwanga nti buli lwe tuteeka era yongedde okukikkaatiriza nti buli lwe twongera ssente buli lwe twongera obukugu mu kugemesa abaana baffe twongera okuwa chance abaana abo okukola bulungi ate ne baba abalamu mu nnaku ez'omu maaso.
As the head of GAVI, the Vaccine Alliance, we are committed to support your country-led plans. me and my colleagues come to you in humility and respect. We come to you in humility and respect to support your country-led plans.
Twagala okubakakasa ngaffe abavudde mu GAVI tuzze wano n'obwewombeefu n'okubawa ekitiibwa nga tugamba nti tujja kuwagira pulaani zammwe ez'eggwanga, tujja kulaba nti bye muba musazeewo okukola ng'eggwanga tujja kubawagira tukole nammwe tulabe nti obuweereza bulongooka.
May you be blessed always, today and forever.
Mukama abawe omukisa leero ne bulijjo.
Thank you for welcoming us.
Mwebale nnyo okutwaniriza bwe muti.
Let's appreciate the CEO GAVI for those beautiful remarks. Because of time, we are going to kindly request the CEO will be able to recognize the best performing health workers in 4 districts. I'm aware that we have past program managers and also the key partners in the space of immunization. But I'm told the past program managers will be awarded tomorrow at a high-level meeting at Serena in Kampala. But we are going to have at least presentation of the best performing districts from here. So allow me hand over to Dr. Daniel Chabainze, who doubles as our Director Public Health in the Ministry of Health, to guide us in that brief part of the program before we allow our chief guest to carry on with her journey.
Abantu b'Emukolo olunaku lwaleero tugenda kulabayo abazira 4 mu districts 4 abagenda okufuna emidaali emirala tugenda gigabira Kampala. Mu district y'Ebuyikwe tugenda kulaba omukozi gwe bayita Muzaale Julius, Mr. Muzaale Julius, ne VHT gwe bayita Ochiti Bernard. Emukono tugenda kulaba health worker nabu Kenya Stella, VHT Kiddawalime Geoffrey. Nema mugenda kubeera health Nema IP.
We are only going to recognize here the people here. Everybody else can participate. Only the people here.
Nfunye okuwabulwa okulungi ennyo kasi tugenda ku Kayunga. Ow'Ekayunga gwe tugenda okuwa omudaali leero bamuyita Prosi Namuyombya Kawongo. VHT bamuyita Nandawula Farida. Then asembyeyo ow'Ekampala tugenda kuwa bayita Faith Mase Atimu okuva mu Kiswa Health Center 4. Mwebale nnyo, mwebalidde abantu abo tuyise mugenda kujja wano bandi nga bwekuba bagenda kugenda wali maaso nga bandi anthem bwe beetegeka.
If your name has been read out, move towards where the chief guest is seated. Sebo mbadde nkusaba osembere eri musobole okufuna ebirabo byammwe. Dr. Daniel, we need to know why they are being recognized. So the program manager, UNEP, please step towards the microphone to guide us on why these specific health workers and village health teams are being recognized on this special day of commemorating 50 years of immunization.
Guest of honor, these workers were identified by their own districts
as having performed very well in the space of immunization. Each district was able to identify one health worker, one village health worker, and one partner who supports immunization. So that's how they were identified in these 4 districts that surround Mukono.
The purpose of this recognition is really not that they are the only ones, but there are people who perform and go beyond the norm. The outreaches, the community mobilization, being there all the time. So we really want to thank you so much for please, we want you to know that we may not give you a lot, but we appreciate. This is a gesture, and Ministry of Health, together with the partners, we know that we cannot do without you, and you are the most treasured people that we have. And
Omukolo wa Ministry y'ebamu, Dr. Diana Atwine Kanzira ali mu kwogerako n'abantu abanokoddwayo okuva mu districts ezo kuliko Mukono, Buyikwe, Kayunga ne Kampala, nti abantu bano balondeddwa amalwaliro gaabwe gennyini okubanga bamu ku bakoze obulungi ennyo omwaka guno. Nagamba nti Ministry terina binene nnyo byeyinza kubawa, nti naye olw'akatono ako akatono ako bakasiime kakati iseeyo abantu abo abamu ku bakoze obulungi ennyo bagenda kubanga baweebwa nti eddwaliro lyayogerako nti libayambyeko nnyo ku bakyala abali embuto okugenda okulaba nga bafuna eddagala lyabwe, okulaba mu ngeri y'okutangira omwana obutafuna kawuka ka mukenenya ng'azaalibwa okuva ku maama eri abakyala bafuna embuto nga bakalina oba bafuna obulwadde obwo nga bali embuto, nti eddwaliro libayambyeko nnyo kinene okubunyisa enjiri eyo, nti omwana omukyala asobola okuzaala omwana ng'atalina kawuka ka mukenenya. Kakati nno oyo omukyala yenna muyomba naye aweereddwa ekirabo. Eddwaliro basiimye abazadde obutebalirira oba obutebalira okugamba okuwaayo kyonna kye basobola, obuteekanasa, obuteekulumbaza, kwegamba okuwaayo obudde bwabwe batutta abaana mu ddwaliro, bagenze ne babatwala mu kugemebwa, abazadde ne babategeeza obuvunaanyizibwa bwabwe. Waliwo omukyala gwe badde baŋŋamba nti jjo yabadde ku lunaku lwokutaano yagenda mu ddwaliro ng'ali lubuto ne bamupima, yabalaga nti alina kamunguluze mungi, naye bagenda okumupima ng'omusaayi gwe mutono, bamubuza eddagala lye tubadde tukuwa lyobadde olimira, abadde talimira, mbulireeta kamunguluze. Kakati nno ebyo bimu ku bintu eby'enjawulo abasawo bano ebibaweesezza ebirabo nti bafuddeyo okubunyisa enjiri, ti lwaki omukyala yeetaaga okugenda kwa ntento oba mu ddwaliro ng'ali lubuto, lwaki omukyala yanditutta abaana oba omwana okugemebwa, lwaki omukyala yandibadde akola kyonna asobola okukola okubeezaawo abaana